Welcome everyone to our Wednesday webinar this month. We're so excited to share this webinar with you on life after LSVT Loud and LSVT Big. And our goal of this webinar, if you're a person that has received LSVT Loud or LSVT Big, is to share with you some real keys on helping you to maintain the treatment gains that you worked so hard for during your 1 month of LSVT Loud or LSVT Big. Perhaps you're someone that is going through the treatments right now, and this will also be useful information for you. Or maybe you're a healthcare professional that's joining us to learn a little bit more about what happens after LSVT Loud and LSVT Big. So regardless of who is joining us for this webinar, we welcome you, and we're glad that you've taken some time out of your day. My name is Laura Gousse. I'm a physical therapist and one of the LSVT Big training and certification faculty and Chief Clinical Officer of LSVT Big. I'm joined by my colleague, Angela Halpern, a speech-language pathologist and LSVT Loud faculty and Chief Clinical Officer of LSVT Loud. So we welcome you both, and you'll be hearing from both of us in this webinar. I won't read our biographies, but they are here for you. Both Angela and I have many years of experience in LSVT Loud and LSVT Big. And if you are a clinician who is intending to use this webinar for self-reported CE activity, these biographies will be helpful for you in doing that. Some brief disclosures: both Angela and I are employees of LSVT Global and receive lecture and webinar honorarium, and we also have a treatment preference for the LSVT Loud and LSVT Big treatment techniques. You might have joined webinars with us in the past, but this might also be your first webinar. So just a few key logistics. Right now, your microphones are muted, so there's no interference or noise coming from background environment so that you can hear us clearly. We will give you some information at the end of this webinar on how to ask questions, but you might have noticed that on your control panel, it says either chat or questions. Feel free to type in your questions at any time and we'll stockpile those. At the end of today's webinar, Angela and I will get through as many of your questions related to this topic as we can. We'll also tell you about how you can ask questions later if you think of questions later on. At the end of this webinar, there will also be a survey that pops up after you log off the webinar. It will also come in an email about a week later. Feel free to take that survey in either form, whether it's at the end of the webinar or email, but we really do value your input. It helps us tremendously every year as we go forward and plan for new topics, get feedback about what you liked, what you'd like to hear more of, if there were any difficulties in audio, video, etc. So please do fill out that survey. It should take 5 minutes or less to do so. In this next slide, I'll just talk briefly about continuing education units in case you're a therapist who is joining us. And with that, I'll say also that if you're an LSVT certified therapist, we did do parallel webinars on this topic a little bit more in depth this week. If you didn't join those webinars but are interested, you'll be able to find them shortly through your clinician account as an on-demand webinar. And lastly, before I move on, there are handouts. So if you did not receive an email with a copy of the slide handout, you can find that also in your control panel. There should be a little tab that says handouts. If you click on the triangle just to the left of it, it'll open up and you can save, print, or download that handout. And now some information on self-reported CE activity. If you are a therapist, please note that these aren't state registered or pre-approved for CE activity, but if your state or association allows for self-reported CE activity, we'd be happy to send you a certificate. Just email us after the webinar at webinars@lsvtglobal.com to request a certificate, and it will include your name, the date, and the duration of the webinar, as well as the title of this webinar as well. You must attend the full hour. If you're not sure about your state licensing requirements, please do contact your state board or your state therapy associations to inquire about that. And these are the learning objectives for our webinar today. By the end of this webinar, we hope that you'll be able to summarize the lifelong model of care that's employed by the LSVT programs, recognize the reason for what we call tune-ups after LSVT Loud and LSVT Big. We want you to be able to list tools and technology that can support people in their home exercise practice. And lastly, describe LSVT Loud for Life and Big for Life and how they can help graduates of the LSVT programs. So before we get into the heart of our content today, we'd really like to know who's joining us, whether you're a person with PD, a family member, a friend, a caregiver, and other could be, of course, many things. You could be a healthcare professional, an interested person, etc. So give me just a minute to launch this poll, and I'll give you about 30 seconds or so to answer it. So here we go. Should be a pretty quick answer here. We'll just give about 5 or 10 more seconds until almost everyone has voted. All right, and let me just share those results with you. So it looks like about 69% of you are in that other category, and 22% are persons with Parkinson's, and 9% are family members, friends, or caregivers. So thank you for sharing that with us. It's always helpful as we gear our presentation towards those who are joining us. All right. So one more poll. If you are one of those 22% that have PD who are joining us, we'd love to know if you've received LSVT Loud, which is the speech therapy program, LSVT Big, which is the physical and occupational therapy program, or both. So let me pull up that poll. And you should be able to see it now and vote. And again, I'll give you 20 or 30 seconds to complete that polling. If you're not a person with PD, of course, you don't have to answer this one. And we'll just keep on going a few more seconds here. Okay. All right, so I will share this poll here, and it looks like about of you that voted, which is just a few of you, half of you had both, 33% have had LSVT Big, and 17% of you have had LSVT Loud. So great. And in this webinar, you'll learn a little bit more about both of these treatments so that you can be informed in case there's one that you're interested in that you haven't had yet. So brief definition, if you are not familiar with the LSVT programs, these are intensive amplitude-based exercise and therapy programs for what we call the speech motor system and the limb motor system. So think of your limbs as your arms, your legs, moving those in a bigger way. It's not just limited to exercise, however, it also provides what we call re-education of the sensory motor system so that you learn how more normal movement and more normal voice feel because there is a sensory deficit that's associated with Parkinson's disease. It is Parkinson's specific and based on specific hypotheses related to the smallness of movement and the slowness of movement that are seen in Parkinson's disease. It includes all the principles of neuroplasticity. So those are principles of exercise and practice that we can use to improve brain change, to improve brain function. It's research-based, so a lot of therapy programs today are what we call evidence-informed. They pull principles of exercise and neuroplasticity and motor learning to inform their practice, but LSVT Loud and LSVT Big go beyond that in that they have close to 30 years of research specifically on these programs as well. And lastly, they're personalized therapy programs. So although they're treatment protocols, they're very much personalized to you in terms of what you want to work on and what you need to work on related to your communication, your voice, your movement, your mobility, your activities of daily living, and so on. We know that these are intensive programs. The treatment is delivered in 1 month. You're seen for each therapy 4 consecutive days a week for 4 weeks. You also have daily homework practice all 30 days of the month, and what we call daily carryover exercises to help you use your bigger movements and louder voice outside of therapy all 30 days of the month. And the goal of this is to really establish a lifelong habit of practice, because we know how important exercise is in the long-term management of people with Parkinson's disease. And this is supported over and over again in the literature. We also know from research on what's called motor learning and neuroplasticity that intensity of training and repetition are really keys to making these successful changes that are lasting and that don't just simply disappear after you're discharged from therapy. So these are some brief summaries of what the treatment sessions look like. Remember, the treatment sessions are 60 minutes long for both LSVT Loud and LSVT Big. So they're separate protocols, but this is what's included in a typical LSVT Loud treatment session. You'd start with what are called daily exercises, and those include something called AWS, where you would really work on sustained vowel phonation and a repetitive basis to really build the endurance and the strength of your voice, multiple repetitions. Then you'd be working on an exercise called highs and lows, where you would take that nice strong ah and work on your range of voice and range of frequency. And then lastly, you would be working on what are called functional speech phrases or functional phrases, where you would choose things that you typically say every day, like good morning, what's for dinner, see you later, things like that, and practice them over and over again in your louder, healthier voice to really build that that strength of voice, and also to help you to remember to use your louder voice throughout the day. So those are kind of the building blocks of improved speech and voice. It doesn't stop there though. What's really, really integral to success in LSVT Loud is the application to functional communication. So in the latter half of the session, you'd work on functional communication tasks called hierarchy exercises. You would start with structured reading tasks using your louder, more healthy voice, and then work towards off-the-cuff conversations that are real world. And think about the type of communication that you do every day, where you're talking in the phone and the person can't hear you. Maybe there's noise in the background. Maybe you're walking and talking or doing something else at the same time. So the goal is by the end of 4 weeks that you would be able to effectively communicate with a voice that can be heard in any type of situation, even more complex situations. You would also have homework exercises that you do that only take 10 or 15 minutes a day, but they should be done all 30 days of the month. And then carryover exercises, which are real world assignments of today. Here's how I want you to use your loud voice outside of therapy. And those are assigned all 30 days of the month as well. LSVT Big treatment protocol delivered by physical and occupational therapists was built based upon the LSVT Loud treatment protocol. And so the framework is the same, although it's working on movement instead of on voice. So we're working on bigger movement. We recognize that Parkinson's causes movements to be too small and too slow. And so this is aimed to help override that and train more normal movement. We do that through a series of exercises that are large amplitude in all directions called maximal daily exercises. We work on simple movements called functional component tasks, such as sitting to standing, getting your keys out of the pocket, really simple movements to help you remember to use your bigger movements throughout the day. We always work on walking big, so bigger arm swings, bigger steps to make your walking more like it should be before you had Parkinson's disease. And then just like in LSVT Loud, we work on more complex tasks that are personalized to you. It could be things that you're having difficulty with, such as getting in and out of bed, getting dressed. It could be recreational, like playing golf. It could be something related to your work. So the idea is that by the end of the 4 weeks, you can perform that whole task quite normally with normal amplitude of movement, normal speed, independently, safely, etc. And just like in LSVT Loud, you'd also have daily homework exercises, about 15 to 20 minutes a day, and carryover assignments all 30 days of the month as well. Our goal for both programs, if you're a person with Parkinson's, is that we want you to be able to use your bigger movements and louder voice more automatically in everyday life. And we expect that there's going to be long-term carryover of increased amplitude use. When we use the terms loud and big, we don't intend to say that it's exaggerated movement or voice that's yelling. When we say loud or big, we just mean rescaling back up to a normal volume of voice or normal movement amplitude that a person without Parkinson's typically uses. So our goal is to really support a lifelong model of care. We know that unfortunately Parkinson's is a chronic disease, it's a neurodegenerative disease, but we've also discovered through research and through clinical practice over the last 20 years that exercise and therapy have really amazing potential to help improve quality of life and to maintain better movements and better voice with people with Parkinson's. The only way that happens, however, is to have a lifelong model of care where you are routinely supported and helped by a whole team of people, including therapists in speech, language pathology, physical therapy, and occupational therapy. So this is our goal. You would receive an initial dosage of LSVT Loud or LSVT Big, and that treatment protocol, like I said, is an intensive 1-month treatment protocol. It's a minimum of 16 visits for each LSVT Loud and LSVT Big. Those can be done in the same month, so you get really double intensity, or you could choose to do them in separate months, but they are separate treatment protocols. Then we say, you really need to do your daily exercises to not only improve your movement and voice, but to sustain it and maintain those gains over time. And then after discharge, we really encourage continued practice. It could be through our Loud for Life and Big for Life programs that Angela will be telling you about later that help and support graduates of the LSVT programs to maintain their movement in a really fun social environment. And then lastly, we have what are called scheduled tune-ups, where you'd come back to see your therapist for checkups and possible short doses of therapy, typically every 3 to 12 months. So in a nutshell, our model of care is very similar to a dental model of care that you're probably very familiar with, where you don't just see the dentist once and he says, oh, never see you again. I've cleaned your teeth. I've fixed everything. Have a great life. No, your dentist always says, I fixed everything, but floss and brush your teeth every day to maintain your oral health. And then what does he always say, or she always say? They say, come back in 6 months for your next checkup. They make sure that everything looks good. If there's anything that needs to be fixed or corrected, certainly they say so. And they reinforce your habit of good oral hygiene and oral care. Our model is just the same. So you have this intensive treatment to restore and improve your function. And we really recommend that this happens as soon as possible after diagnosis. So don't wait until you have a cracked tooth or a cavity, really start early. And we say the same thing with our patients with Parkinson's is start early as soon as possible after diagnosis before there's a lot to fix to help you really get skills in how to keep your movements and your voice alive, how to prevent functional decline. And then come back every 3 to 12 months and your therapist will determine exactly when it's right for you to come back. And lastly, they say do your exercises every day. So just like you brush and floss every day, do your exercises every day, because really it's like that pill in your pocket. If you don't take it, it's not going to do you any good. If you don't take your exercises every day, they're not going to last long term. So doing that short dosage every day, really, really important. So about 6 months post-treatment on average, typically your clinician will schedule a checkup appointment for you. Some people might need a checkup a little bit earlier. Those typically are people that maybe have more problems with cognition or memory, maybe have a disorder that's more rapidly progressive, like an atypical Parkinsonism, or someone that just requires more frequent reminders and closer attention and watch to help them maintain their function over time. Now, as they check in with you, and sometimes it's as simple as a phone check-in, you might need no treatment. You might be doing just fine, or your therapist does a reassessment on you and they say, you know what, you're not even the same, but you're even better than you were when I last saw you as a result of your continued practice. We actually see that happening, and how exciting in a neurodegenerative disease that you can maintain and possibly even improve your function. So that's on one end of the scenario, that it might just be a pat on the back to say, good work, keep it going. Things look great. Let's check in again in 6 months. It could be one or several tune-up sessions, and these are really common. Remember that Parkinson's is progressive. We also realize that life happens, and you might have gotten out of the habit of doing your exercises. Maybe you got sick or had an injury or surgery or something like that and got out of the habit. And so these can really help you to get back in the swing of things, get motivated again. It's always good to have a cheerleader, cheering you on periodically, and remind you of this is how it feels to move with the normal movement. This is how it needs to feel to speak with a louder voice that people can hear. And then also, if you have new goals or issues that come up, that's a great opportunity and time to address those new things. Oop, I'm wrong way with my slides here. All right, so in between tune-ups, here's what you do. Certainly practice of the exercises on your own is really important. And there's a number of tools that Angela will be talking about to support you in that, including homework helper videos. We have something called the LSVT Companion. And also we have post-discharge graduate exercise groups called Big for Life and Loud for Life. Beyond that, we highly recommend that you also engage in other types of fitness that you enjoy and that's appropriate for you. Dancing, singing, boxing, water aerobics, bicycling, yoga, tai chi, those are just some of the examples of evidence-based exercise interventions that can be very helpful and very fun for people with Parkinson's disease. Your therapist is a great one to help you identify what's available in your community, what's safe and appropriate for you, and give you recommendations of how you can use your louder voice in bigger movements and excel even to a greater degree as you're engaging in those fitness opportunities. So while regular exercise is important, just remember it does not replace a daily dose of LSVT Big or LSVT Loud. Both are really needed. And although some of the exercises like Tai Chi, for example, use large movements, they're slow movements. And there's some things like bicycling that might be high intensity, but they're not really working on amplitude. And so it's important to have, both the large amplitude movements in your practice, the LSVT loud amplitude focused exercises, and fitness activities that you enjoy as well. So with this, I'm going, actually, I've got one more slide and then I'll turn it over to Angela. So why? And I just shared a little bit about this. Not all exercise focuses on amplitude, and as a person with hypokinesia, which is small movement, bradykinesia, slow movement related to Parkinson's disease, we feel that amplitude focused exercise is really needed every day to help you keep moving bigger and keep talking louder. Function focused as well. Most community-based exercises include intensive practice that's really beneficial for you, but they don't necessarily include practice of functional skills, such as how to get out of a chair, how to button your shirt, how to get dressed, communication activities that are related to everyday life. And lastly, not all exercise programs focus on sensory awareness challenges. It's not just about moving bigger or talking louder, it's about continually recognizing the effort and how that feels, the sensory awareness that, it might feel too loud or too big just to be with the normal limits. And having frequent practice and reminders of this is really helpful. So now I'm going to turn it over to Angela.
Thanks so much, Laura. So as Laura mentioned, I'm going to talk with you in more detail about tools that can support you in maintenance following LSVT Loud and LSVT Big. We all have experienced that what might motivate us to practice may not be the same thing that motivates someone else to practice. So it's nice to have a variety of tools to assist people and see what might work best for each individual. Before we get into a lot of detail on these tools, we would like to have a poll to see what you are familiar with, what you have heard of with these maintenance tools. And then this will help us as we move forward in our descriptions to see your level of familiarity. So Laura is going to be launching a poll, and you're just going to indicate if you are familiar with any of the maintenance tools listed here, and you can select all that apply. So we'll let you go ahead and answer that poll now. Give you a few more seconds to answer that. All right. So the results from that poll, it looks like there is some level of familiarity with many of these tools. Most people having previously heard of Loud for Life group exercise maintenance classes, and then Big for Life next, the LSVT Loud Homework Helper, some people with the LSVT Big Homework Helper, and fewer people with the LSVT Companion. So thank you. That really helps us as we move forward in describing these. And it might be something that you've heard of before, and we'll just go into a bit more detail so you'll get some familiarity. So on the next slide, we're going to look at the LSVT Loud and LSVT Big Homework Helper videos. There's one for LSVT Loud, two for LSVT Big, depending on if you need to do the exercises more in a seated position or a standing position. And we're going to show you video examples in just a second with some brief clips from each of these, but you may have already seen these in your LSVT Loud or LSVT Big therapies. If you're the type of person who likes to exercise with videos, you may enjoy these. And so let's go ahead now, and we'll start with a demonstration of a video clip from the LSVT Loud Homework Helper video. And after you've watched this, we'll talk about it in a bit more detail. And we'll just launch that video.
When you're ready, we'll begin with our first exercise. Watch me, then do what I do. All right, on to our next vocal exercise. As you remember from speech treatment, we're going to take that ah voice and now go low in pitch, like me. Ah.
So with that video, that was a sample of the highs and the lows, which are used for a stretch, a vocal stretch. In Parkinson's disease, the voice can become monotone, so we do those highs and lows to get a stretch. There would be multiple repetitions of that, and then there's also the sustained phonation that has a timer. There are reading materials that would come up and encourage you to follow along with those. So that's a sample of the LSVT loud. Let's look at a sample next of the LSVT big homework helper video.
I'm going to have you watch Jenny and do what she does, and she'll model the exercise first, and then we'll practice. Be sure and start with your big posture, and you're going to step forward, open up big, step back big.
So that was a sample of a clip from that video. They're called homework helpers because, as Laura mentioned, when you go through LSVT loud and LSVT big treatment, there is home practice assigned, and that's really essential for the carryover. So these videos are not intended to be a replacement for therapy, but an adjunct to, if you enjoy exercising with videos, something that can help you either during therapy to continue to do your home practice or after therapy to continue to practice. The LSVT Companion Client Edition, the image you see here, is a tool that can be used for home practice for LSVT loud. And again, this could be used during the therapy or after the therapy for maintenance of results. As you can see, it's a software program that would be loaded on your computer, and it comes with a hand calibrated microphone that is pictured at the top of the laptop here. That microphone is hand calibrated to accurately collect loudness and pitch information from your voice. And so in the next slide, we can see some of the details from the LSVT Companion, some of the key features. It is an FDA cleared medical device. And so with that, it must be used under the care of an LSVT loud certified clinician. So the first question that we ask people when they contact us and say, oh, I'm interested in the companion, could I order one, is who is your LSVT loud certified therapist? The companion can be programmed to collect the loudness information, frequency, and duration information specific to your voice. And that information needs to be provided by the LSVT loud certified therapist who knows you. So they can set those appropriate goals and you're getting the appropriate feedback. Once those goals are set, the companion provides audio and visual feedback based on that. It automatically collects the sound pressure or loudness information, the frequency from the those highs and lows, and duration information. And then it puts all of that into an Excel spreadsheet. And so it can track your progress for you as you practice. And then if you so choose, you can send that Excel spreadsheet to your therapist and she can see over the time in between the tune-up sessions how you're doing with your home practice. Also, it can be programmed and uploaded with reading materials that are personal to you. So you can read as a part of the exercises information that you're interested in. Let's look now at a quick little video sample of what the LSVT Companion Client Edition would look like.
Welcome to a demonstration of the LSVT Companion Home or Client version. This program can be used by individuals with Parkinson's disease or other neural conditions who are receiving LSVT treatment. The program can be used by clients for their homework practice, or it can be used actually to deliver an entire independent treatment session, either within the clinician's clinic or at home by the client. This is the welcome screen for the program, and the client can choose to display data or not. They'll click Start Exercises and then follow the prompts through the program.
Okay, let's get ready. Let's do those loud ahs. I liked that one. Dig deeper, get louder.
As you can see, the program responds to the client's voice in terms of loudness as well as duration and frequency. And the clinician would have set target goals for each individual client, and if those goals are not met, feedback is given to motivate performance.
So that gives you an example with the first AW exercise of how you can get both the audio feedback and the visual feedback of practicing those exercises. The companion is programmed with hundreds of if-then rules for all scenarios. Did I hold it long enough? Did I go loud enough? Did I go high enough? And providing that appropriate feedback as you go through. The next maintenance tool we're going to talk about are postgraduate groups of Loud for Life and Big for Life. These are for people who have graduated from LSVT Loud or LSVT Big therapy. So someone's already been through the whole therapy protocol, and these are tools to help people continue to exercise in a maintenance class with other people. So we want to emphasize this is not therapy, it's an exercise class. And we'll talk about this in a bit more detail. On the next slide. So these are typically community-based. They might be held by a local Parkinson's organization, in a local hospital as a part of the wellness programs. They might be held independently by a therapist. They are led by LSVT Loud and LSVT Big certified clinicians who in this situation are acting as fitness professionals or coaches. And they're typically cash based, and the amount for this varies widely across what we hear across the United States. Some are donation basis, some have a $5 charge, $10 charge. That would really be based on the class where you are located. What we see with the goals with the Loud for Life and Big for Life, the primary goal is to support regular practice of LSVT Loud and LSVT Big exercises and those bigger movements and louder voice that you worked so hard to obtain in that 1 month of therapy. So we really want to help individuals maintain those treatment gains over time in a fun way. So we really see these classes as a way to enhance motivation to exercise with others, to have some fun with it. Secondarily, we really see they provide great social interaction amongst the individuals in the class. It can be a way to reduce care partner burden. So with the in-person classes, people coming in, they can participate in the class for an hour, the care partner can go do something else, helps people to maintain their movement, their voice, which reduces that care partner burden because of safety issues and concerns and more increased independence. They just promote general overall wellness and can be a way to reduce overall health costs in that the coaches have more frequent interaction with individuals in the class. So they can be tuning into how's someone doing? Are they continuing to practice? Are they continuing to maintain? Or do they need to be referred back to their LSVT Loud or LSVT Big certified therapist for some more intensive tune-ups? So it can be one more step in the tool for prevention of really staying on top of that maintenance for individuals. And this last point is something that I love to see in the classes I teach, this peer interaction and the camaraderie. I can tell someone as a speech language pathologist over and over, yes, that voice sounds great. It's really not too loud. You sound wonderful. When you talk that way, people can hear and understand you. And someone may respond to me, are you sure? I really feel like I'm shouting. But if someone else in the class makes that same comment, because that person also has Parkinson's disease and knows what it feels like to feel like you're talking too loud when everyone else is saying, no, it sounds fine, goes a lot further in that encouragement. And people just have fun. There's lots of laughing, lots of support for each other in the class. So let's talk a little bit more about what happens in a class. With the Loud for Life class and Big for Life classes, but we'll start with Loud for Life. For both, we're helping people to practice what they learned in treatment. So the first half of Loud for Life, we're going over those daily exercises and doing those together as the class. So the ahs and the highs and lows and the functional phrases. And we add some cognitive and motor dual tasks to add additional challenges for people. Something we've been having a lot of fun doing are things related to whatever national day it might be. So, for example, last week it was National Pizza Day. So while people did their I told them I wanted them to keep that same loudness while they were thinking of all different types of toppings for pizza. So adding an additional cognitive challenge. Then, while we did the they had to make big movements as if they were cutting the pizza. So, adding those dual tasks in ways that are salient and functional. The second half of the session is conversation cognitive tasks based on the communication goals, hobbies, interests of the group. So some of the images you see here, we've done plays where people were enacting different roles, book reviews in partner discussions, and then in the top photo with the orange table tent, this was an activity where people had an image that they could see but their partner couldn't see, and in their loud voice they had to describe how to draw it to the partner. So a fun communication activity involving some artwork there. The next slide will show a few more activity ideas. And again, we get these based on what people in the class want to do. So I've had people who like to tell jokes or do poetry, and we'll do an open mic night. A lot of people like to play games. So in their loud voices, we play different word games. We've had people share a treasure, bring that in and describe it. So lots of variety of ideas here, all keeping that loud voice. So what happens in Big for Life? Similar sort of structure. It's a 1-hour class and focusing on the LSVT Big daily exercises done together, really targeting getting that increased amplitude for individuals as they're practicing those. And then taking that and putting it into function related practice. Function is the key word here. Not just doing exercises that don't have a translation to people's real world, but taking that bigger amplitude that was trained in the daily exercises and putting it into bigger movements needed for functional activities. And you see some picture images of what some of those functional activities might be. And the next slide, we will look at some more examples. So doing different types of themed practice. For example, around Thanksgiving time, doing the theme of thinking of sitting around the Thanksgiving table, and you have to use your big amplitude movements to pass the plate to the next person. Or you have to use those big movements to carve the turkey or stir the mashed potatoes. Practicing going to the movies, so having to use big movements as you go sideways into the aisle to sit in the seat or navigate the steps up and down. So again, these are based on feedback from the class participants of things they want to work on, and also functionally. I'm having trouble getting in and out of the car. Let's work on that in a functional context. In the next slide, we're going to show you an image of, if you were to go to our website, how to find a Loud for Life or Big for Life class near you. On our website, there's a place to find LSVT Clinicians. It's a big orange button in the top right. And then you can put in your zip code, and up will appear LSVT Loud or LSVT Big Clinicians near you. If an LSVT Loud clinician has also taken a class to learn how to provide a Loud for Life class, it will show up in their profile as you see circled here. Similarly, for LSVT Big, it will say Big for Life provider. As always, though, if you're looking for someone and you need help and you don't see someone near you, please contact us. Sometimes we have information about these resources that just may not be listed on the website. So you're probably all thinking, okay, these in-person classes look great, but what about right now with COVID? I can't go to an in-person class. Or even thinking ahead after COVID, I live 50 minutes outside of where a class is located. I don't have access to a class, but I would really like to participate. The good news is these classes can be offered virtually very effectively. And the way that these are offered is loud for life and big for life in a virtual structure. So on the next slide, you'll see a screenshot. The top would be a loud for life virtual class, the bottom, big for life. And with this, it's the same format that we do with the in-person classes. We actually, as a team at LSVT Global, had a goal last February, prior to knowing what COVID would do, to develop these virtual delivery options to help people have more accessibility to classes near them. Little did we know that COVID would just propel the need for that. And so the classes, we do the same things we would do in person, and they have been quite successful. I'm going to turn it over now to Laura to talk about this a little bit more.
All right, thanks, Angela. So as Angela mentioned, we have been working for the last probably 9 months on development of a new platform called LSVT for Life. And it's a membership type of platform where you can sign up on a monthly basis and have access to these live classes that we deliver via Zoom. They're super fun, either big for life or loud for life or both, depending on which programs you have graduated from. You'll also have access to all of the homework helper videos through the website, lots of functional tips and clips, frequently asked questions, and so on. So we're still in the beta launch phase, but we're really, really excited about it. And probably in about a month or so, we'll be ready for full launch. If you want to learn more, you can email us. We've also listed the website URL here for our new site. And I'll give you a quick sneak peek of it as long as this cooperates with me, and just so you know what the website kind of looks like. All right, so this would be the home page of the website that tells you a little bit about what it is, what's included that I just described. It goes through how to become a member, and we'll just take a quick look at the Big for Life side. So you can see that right now we have twice a week classes that you can sign up for. There's also recorded classes, so if you can't make it to a live one, you can follow along with the recorded version. We have all of the video clips from the homework helper, so you wouldn't have to purchase that separately. There's going to be a variety of videos. You can see these are already there on functional things like reaching for a glass, how to get out of a low sofa, how to get your socks on and off. All of those things that maybe you learned during LSVT Big but need a little refresher or a little motivation on. The same thing for Loud for Life would be included in those menus. So again, we're just really excited about that. And as it's officially launched, we'll be sharing more information with you. If you're a person with PD that wants to be involved in our beta launch, we'd also be happy to share information with you on that as well. All right, so back to the slides here. This is something that we wanted to share with you. We've, over the last year, been learning so much from all of our wonderful clients, and we call them really friends now, who have been participants in our Loud for Life and Big for Life virtual classes. And we've been learning about what they really liked, what was beneficial to them, so that we could expand on that and develop these programs that were meaningful to them. And this is one of the quotes: "As a motivated person who faithfully did my LSVT Big exercises daily for years by myself, I thought I was doing fine. However, the energy of the class, the camaraderie of the participants makes the exercises much more fun. Furthermore, I'm continually learning from the expert instructors, thereby significantly improving the quality and energy of my daily exercises." And really, that's our whole goal, is to support people, not just during the 1 month of treatment, but continuing to support people with PD and other diagnoses lifelong. So in summary, you know now that the LSVT programs are evidence-based treatments that can have a really positive impact on communication, mobility, and activities of daily living. Tune-ups are an essential part of lifelong model of care. Home exercise practice following treatment is really key to sustained success. And there are tools to help you. The videos that Angela mentioned, the companion, these maintenance classes, because you deserve the care and you're worth the effort. Parkinson's is a disease that is chronic and certainly not something that is fun, but it can be managed in a very successful way to continue to maintain and improve quality of life. If you're interested in getting started with LSVT Loud and LSVT Big treatment, it's very easy. You can ask your doctor. It could be your primary care physician. It could be a neurologist simply for a referral for evaluation and treatment to an LSVT certified therapist. And you can find them, like Angela said, on our website with that big orange button that says Find LSVT Clinicians. And then you can look to see who is in your area that's certified. When you're searching for a clinician, be sure to look at the type of organization. Therapists can exist in all practice settings, such as home health, outpatient, skilled nursing facilities. So you want to make sure to search for one in the type of practice setting that meets your current needs. And if you're interested in learning more about the homework helper videos, we've given you some information here. Just note that they are available in DVD format, but you can also get them in a downloadable format and a streaming format, so you can watch them from your phone or iPad or computer, whatever is convenient for you. You can get them through the LSVT Global store or through Amazon. And now we have a few minutes left that we'd really love to address your questions related to this important topic of maintenance of therapy gains following LSVT Loud and LSVT Big. You can ask your questions in the control panel. You can do that by typing it in, and we'll take those questions and answer them out loud. You can raise your hand. There's a little hand icon on your control panel. Just make sure that if you do this, that you unmute your microphone when we call your name so that we can hear you. And if you think of questions later, feel free to email us anytime at info@lsvtglobal.com, and we can answer those questions for you. As you're typing in your questions, I'll just invite you to our webinar for next month on LSVT treatments applied to neurological conditions beyond Parkinson's disease. A common question we get from clinicians is it limited to Parkinson's? Can we use it to help people with other neurological diagnoses like stroke, MS, atypical Parkinsonisms, and even pediatric applications? So we'll be talking about all of that. That's next month, Wednesday, March 17th from 2 to 3 p.m. Eastern. So same time as today, just a month later. It is intended for allied health professionals who are not yet certified in LSVT Loud or LSVT Big. However, if you're a person with Parkinson's, a caregiver, another medical professional, you're certainly welcome to join that webinar as well, and it will be free for you. So I'm just going to check for questions here, Angela, to see if any came in. And I think so far we just have one question about the slide handouts, but he has left. For those of you that are wondering, the handout is in your control panel, and you'll be able to download this from the blog as well if you're joining us on demand at a future time. There is a question about, is this covered by Medicare? So Angela, do you want to take the first stab at that?
Sure. So the Loud for Life and Big for Life, because they are exercise classes that happen after therapy, those are not covered by insurance because they're not a therapy class, they're an exercise class, similar as if you took a aerobics class or something like that. The LSVT Loud and LSVT Big therapies, when you're doing your 1 month of individual one-on-one therapy with either a speech language pathologist or a physical or occupational therapist, those, if your insurance covers physical, occupational, or speech therapy, should be covered. And we do historically have evidence from our therapists across the country that Medicare is covering that as well. If you are working with a therapist and they say something to the regards of, oh, I don't think insurance is going to cover that, or any of those types of comments, feel free to contact us. We have many, many resources that we can provide to the certified therapists if they've run into any roadblocks with that.
All right, thanks, Angela. Right now, I don't see any other questions, and we are close to the top of the hour, so maybe we'll give you a few minutes left of your day back to you again. We just want to say thank you again for joining us. We hope that this was helpful information to you. You can find a lot more information on our website or always through emailing us for specific questions. Please do remember to complete the survey, and hope you all have a great day, and we shall see you next month.
Thanks so much.